So today we're going to talk about arthritis. We're going to go in depth on what it is and how it works. I'm going to explain how a synovial joint like this works to better understand why arthritis is the way it is and how it works. So yes, we first have to do a quick anatomy lesson here to understand arthritis a little better. So in order to understand how it works in the process, we need to understand some basic pieces of it. So we have two bones here, sort of the way any joint is made up, or where two bones meet and articulate. So essentially, this is where they meet, and this is the articulation spot in between. Now this blue outer portion is the joint capsule where the synovial lining lives, which will become important later. And then this yellowish area that sort of covers the top of the bones is what's called the cartilage. And this cartilage is where the two bones meet. And the idea behind cartilage is that it creates this surface barrier to the bones underneath. The bones are very sensitive and have a great innervation. And the problem is if they're just rubbing together, essentially they create friction and therefore pain. So we have what's called articular cartilage or cartilage that helps reduce this friction. It also creates a decreased compressive area so that the forces can get dispersed and it doesn't hurt the bones as much. And this is how all synovial joints work. Now, the beautiful thing is this cartilage is made up of mostly a collagen, a type of collagen that's designed to reduce compression and friction, which are the two big things where two bones meet. Now, the other important thing is when you provide lubrication to this cartilage, it gets much more slippery. And we get this through the synovium, which is really what lines the joints. So this blue area here, and it goes all through the joints. Now, the beauty behind this synovium is that it's produced with motion. And this is very important to understand. So we have cartilage, which unfortunately was designed with pretty poor blood supply. Now, that also comes with the caveat that it's also not super well innervated, meaning we don't really feel it all that well. So, because it doesn't have good blood supply either, we have to get this tissue nutrition somehow. And because it doesn't have blood, the way we get this nutrition is through the synovium. The synovial lining produces this joint fluid, and this joint fluid is not only a lubrication, but it has all the nutrition that we need to help supply cartilage with the nutrition it needs. The beauty of this is that when we are moving, we are getting nutrition to the joints. And that's how this whole system works. Now, if we disrupt this system, thereby something like arthritis, which is where the cartilage starts to break down, we now have disrupted this flow of nutrition and therefore helping to lubricate the joint. And when we can't lubricate the joint, it starts to get stiff and brittle along with other things. But the thing to understand here is how the joint system works. So if you understand this joint system, you can understand the next piece, which is understanding arthritis. So basically, very simply what arthritis is it's the breakdown of this cartilage. And it's really the wearing away. So as this cartilage starts to thin out, we would describe that as arthritis. There's different degrees of arthritis, and there's also a lot of different things that come along with arthritis. But that is the main caveat to arthritis. So if we take that and we start to wear the cartilage or the lining away, that's really the cushion between the two bones. So once we no longer have that nice sort of low friction and nice, thick barrier to compression, we now have two bones that are hitting and rubbing against each other. And like I said before, because those bones are very well innervated, that's where we start to get that deep aching pain that's associated with arthritis. Typically, people will start to experience aching pain at the end of the day, especially when they're more active, as well as sometimes aching in the morning, or sort of that stiffness that's tough to get going in the morning. And then once you do and you get some joint fluid going, it starts to feel a little bit better. This is why you experience the symptoms that you experience. Now, the other thing that's important to understand is that as that wears away, what our body does naturally over time is it starts to spread the forces out. So what you'll get is often a mushrooming out of the bones on either side. That's why when you sometimes see, like an arthritic knee, for example, they start to get very wide. And it's the reason that they do that because they're trying to spread those forces out more evenly and make it less essentially uncomfortable for the joint. The more we can spread those forces, the less compression there is in a specific spot and hopefully doesn't hurt as much. So sometimes you'll see that mushrooming out, which also sometimes comes along with what we call bone spurs, where you get these pieces that start to uh, calcify, and they're these bony spots that can start to pinch as you bend the joint. So if you have two pieces of bone spurs sticking out, and as you bend, they start to bend into each other, that can be indicative of that really stiff, sharp pain as you try to bend the joint. These are some of the basic principles and the basic ideas that come along with the wearing down of the cartilage, aka arthritis, inside a joint.